Presenting the proposal for the fiscal spending for the year 2020 at the 12th Parliament at the Arthur Chung Conference Centre on Wednesday was Minister of Public Works Juan Edgell. Edgell, in speaking on the subject of health, outlined that a whopping $51.7 billion has been allocated to improve past programs in the sector that, according to him, were neglected by the past administration. To name a few, he referenced the immunization program, the HIV/AIDS program, chronic non-communicable diseases programs, and mental health.
As an immediate measure, this budget will provide for the purchase of adequate drugs and medical supplies. We'll buy test kits and antiretrovirals for HIV patients, start fixing the diagnostic imaging capacity of many of the hospitals, fix many of the infrastructural defects at facilities across the country, and work quickly to improve the quality of health care.
The minister further provided a breakdown of how much money will be assigned for the purpose of procuring the drugs.
Of this amount, $14.3 billion is budgeted for the procurement of drugs and medical supplies. Corrective action to facilitate the procurement of emergency supplies of drugs and medical supplies to the tune of $3.2 billion is underway, and a full review of quantification and procurement practices is being currently undertaken. Mr. Speaker, there is a lack of evidence of any purchase drugs and medical supplies since 2017.
He added that his administration will also inject funds into the completion of the Smart Hospital initiatives at Diamond, Paramakatoy, Mabaruma, Leonora, and Lethem as a long-term project in the sector. Redevelopment plans are also on stream for several regional hospitals.
Funding has been allocated for the redevelopment of the West Demerara, Suddy, and Bartica hospitals. Preliminary discussions are being undertaken to operationalize a national electronic patient information system. In addition, government has received several inquiries from local and international organizations to develop specialty care facilities in Guyana.
$15 million has also been budgeted to continue the extension of the Accident and Emergency and Medical Outpatient Department at the Georgetown Hospital. The news of a state-of-the-art trauma center to replace the Accident and Emergency Department was first raised by former Finance Minister Winston Jordan in his budget speech during Budget 2019 debate. The former Health Minister, Vola Lawrence, declared in 2018 that the center would have been built by the next year, but to date, the Accident and Emergency Department is still functional. The APNU-AFC administration had allotted $35.9 billion to the health sector in 2018. With regards to the controversial infectious disease hospital established under the APNU-AFC administration at Liliendal, East Coast, Demerara, Edgell posited that due to the poor planning that went into the conceptualization of the facility, the government was forced to budget a further $790 million in addition to the $1.6 billion that was already sunk to operationalize the hospital. The facility will be transformed to cater for 200 patients. Temika Rodney reporting for the HGP Nightly News.